Good afternoon. My name is Bill Henricks. I am President and CEO for All Health Network, a community mental health center serving Arapahoe and Douglas counties. Thank you for establishing a statewide task force to develop new directions for behavioral health in Colorado and for the opportunity to testify today. I have a doctorate in clinical psychology, a master's in business administration. I've worked in behavioral health for over 34 years. Throughout my career, I've operated or consulted on behavioral health services in 14 states, worked with some of the nation's leading behavioral health care organizations to create programs in a variety of treatment settings, including hospitals, schools, primary care clinics, outpatient clinics, and skilled nursing facilities. For the past 2.5 years, I've served as President and CEO at All Health. I believe my background gives me a unique perspective on what is happening with behavioral health services in Colorado and provides me an array of treatment models which may be helpful as we seek to improve access, cost effectiveness, and clinical outcomes in Colorado. Establish priorities. Focus is power. To begin improving the mental health of Coloradans, we must establish clear priorities and commit the resources to achieve them. If we choose the correct priorities, we can improve mental health and save money at the same time. This will create more resources to address additional priorities. One strategy is to target behavioral health conditions associated with potentially avoidable and high-cost medical services for aggressive intervention and management. According to data from HCPF, substance use disorders and mood disorders are among the top 10 conditions for associated medical costs. Prioritizing and successfully treating these conditions will likely result in substantial reductions in medical costs. Medical cost savings could then be used to address other behavioral health priorities. This is exactly the approach we are taking at All Health Network. We are creating specialized intensive outpatient programs, one targeted at substance use disorders, one targeted at depression, with a focus on reducing clinical symptoms as well as unnecessary medical costs. We believe our programs will create substantial reductions in medical costs, savings that can be used to address other behavioral health priorities in our region. Stabilize and streamline behavioral health funding. Behavioral health funding in Colorado is unstable and highly fragmented. At All Health Network, for example, our model of payment through the state has changed significantly and repeatedly in recent years. In terms of fragmentation, we receive revenues from nearly 300 funding sources. This includes both government and commercial payers. Often funding changes are made with little or no warning. Given this instability and fragmentation in funding, it is distressing, but not surprising, to hear consumers report concerns about trouble accessing services or gaps in clinical care. In addition to establishing behavioral health priorities, I encourage the state to consider opportunities to stabilize and streamline funding across the state. Learn from other states. Lastly, I believe there is much to learn by looking across the country to identify potential solutions to the behavioral health crises we face here. Here are just a couple of examples. The Depression Improvement Across Minnesota Offering New Directions model, or the DIAMOND model. While many states struggle to integrate behavioral health with primary care, Minnesota has been doing this successfully for over a decade. The DIAMOND model has improved access, outcomes, and reduced overall health care costs. Second, prioritized list of health services. Oregon's prioritized list identifies health care services most highly associated with improved quality of life and reduced health care spending over time. Treatment services for substance use and depression are consistently near the top of Oregon's funding priorities. As a result, access to key services has improved and the overall medical cost for Medicaid beneficiaries is significantly reduced. In closing, I thank you for the opportunity to provide behavioral health services to Coloradans in Arapahoe and Douglas counties. I look forward to partnering with you to identify priorities, stabilize and streamline funding, and learn better ways to meet the behavioral health needs of Coloradans across the state. Thank you very much.
Thank you.